Hi parents, I'm Dr. Shivani Deswal. I'm a child gastro and liver specialist in Gurgaon. Today I'm going to talk about blood in stools. It is very important for parents to note few important points whenever their child is passing blood in stools. Number 1, what is the color of the stool? Is the child passing bright red color, which is staining the tissue paper? Is the child passing maroon color? Is the child passing black tarry stools? Number 2, is your child having hard stools along with blood, or your child is having recurrent loose stools? Number 3, is your child having pain while passing stools along with blood? It is a painless bleed. Number 4, is your child having large amount of blood in stools, or they are just small drops or streaks? These points are very important for your doctor to understand so that he can diagnose what is the cause of your child's blood in stools. For blood in stools, you do not need to consult a surgeon. Pediatric gastroenterologist is the right person to approach. After taking a detailed history, your pediatric gastroenterologist will examine your child in detail. They look for either any lump in the abdomen and also the perianal area for any cut or erosion. Common causes of blood in stools in children are fissure. Number 1, that is a cut or an erosion in the anal area where the child passes stools. It usually happens due to chronic constipation and passage of hard stools. It is an easily treatable condition in which your doctor will advise your child laxatives and a local cream for application. Number 2 cause in children is polyp. The polyp is a small growth which occurs in the rectum. Rectum is a part which holds the stool, or the sigmoid colon, which is the large intestine. In this, there is a small growth which can be pedunculated or it can be sessile, and it leads to fresh red blood along with stools in toddlers and young children. It is a condition which can be easily diagnosed by colonoscopy, and if your doctor finds that there is a polyp, it can be easily cut through the endoscopic method, which is called polypectomy. Your child does not require a surgery for this. The third cause is an infection. If your child is having fever along with loose stools, along with blood in stools, then your pediatric gastroenterologist usually suspects an infection or an inflammation and gives your child a course of antibiotics depending upon whether what kind of infection it is. Pediatric gastroenterologist is suspecting inflammatory bowel disease, then your doctor is going to work your child up with endoscopy and colonoscopy and biopsies and make a confirmatory diagnosis of inflammatory bowel disease, and then start your child on treatment. In small babies, sometimes there is loose stools along with fresh streaks of blood, or sometimes the child is having low hemoglobin and on gross examination you cannot see blood, but stool occult blood is positive. In such cases, many times the cow milk protein allergy is suspected, and your pediatric gastroenterologist will change the feed of your child from animal protein to other formula, and this leads to relief in blood in stools. The other rarer causes of blood in stools sometimes are Meckel's diverticulum, which is a growth in the small intestine ending, and this leads to large amount of maroon or blackish tarry stools, and it is an emergency in which laparoscopic surgery is to be performed to remove the Meckel's diverticulum. These days we are also seeing children with solitary rectal ulcer. It is a small ulcer which forms in the rectum or the sigmoid colon. Usually the cause is chronic constipation and dyssynergia. Another cause of blood in stools can be a bleeding disorder. So if your child is having dengue hemorrhagic fever, or your child is having ITP or any other coagulopathy, this can also lead to blood in stools. So if your child is having blood in stools, it is a condition which should not be ignored. You should consult your pediatric gastroenterologist immediately and get your child evaluated. Most of the conditions are easily treatable by endoscopic method or by medical therapy. Surgical consultation is hardly required.